So one of the first treatments we do when it comes to back pain is we're following the alignment of the spine. We'll actually notice then all of a sudden as we really palpate that you can see the curvatures happening in various places. It can be bending in one area and it could be ricocheting further down. So with lower back pain in particular, as people come through, they end up with a discomfort, whether it's in the centre, left or right. But we always have to look back up at the neck. And we look for various things. Has there been a lot of compression in the neck from maybe poor postural habits? Maybe they have a whiplash scenario, and we may need to exhaust all the areas of the base of the skull, and so on. That'll be the first part. So essentially, when we go through this treatment, we're following the spine. So every single person will be different, and each person may have a different curvature as it goes. So essentially, where the person ends up explaining that they have the pain becomes not important anymore. We have to follow by this. So on our behalf as a clinic, it requires really good palpation skills, but this will end up giving us a full reading of the spine essentially. And as we're going through, we'll be able to work, we'll be taking an initial reading of the skin, and then as we stay on that point, then we start to get further information about the quality of the tissue. And eventually we'll end up with marks where we know that upper on the right side, for example, is a major issue. Here may be a huge issue, and then it could turn out that the point of pain happens to be a major point, and that will be scored in regards to scar tissue and how high or low it can be. And from that's where we all of a sudden focus in, teaching the body essentially that these are three major areas. So if you take a close look at that spine, you really will start to see just how much it's off. Okay, so when we talk about fascial problems, shoulder problems, it's irrelevant really, because now we're starting to see this curve coming right around and then it's going back in on itself again. And by the end of this treatment, you would actually see that this whole line will have straightened up, causing a complete reset of the spinal column and obviously giving total different feedback neurologically to the brain then also. And finally, as we go through, as I said, a part of this treatment will be actually mapping various points on the face to what we had read in the spine as well. So taking our readings again, we actually essentially, if we think of it in this way, is we map the face points to that spine. And we see, is there a issue going on here versus the back? Again, somebody could have had a facial structural issue and all of a sudden you may notice the alignment of the eyebrows was off. You may feel that there's a lazy eye on one side, there could be a jaw drop, and that would be finalising that treatment that we talk about, restructuring the whole spinal column.